CI Connect on demand. We're so excited you're here. Get ready for some awesome content brought to you by some of our amazing staff members at CI Pediatric Therapy Centers. Feel free to pause, rewind, or take a break at any time. All content in this training is designed to provide general recommendations. Though we may discuss particular therapy approaches or strategies, always check in with your child's therapy team when implementing something new at home. If you have any questions or concerns, please contact us at any time at connect@citherapies.com. Thanks!
Hi, so my name is Erin. I am the recreational therapist here at CI, and I'm really glad that you guys all came to hear about Janesville's presentation about supporting your child's mental health. We're really excited that you are here and are going to learn a little bit more about mental health and how CI can help support that. And just as a quick disclaimer before we get started, these presentations are recorded so we can put them on our website for future use for families that weren't able to make it tonight. So if you are comfortable, you can leave your camera on or turn it off, but we do ask that you mute your microphone just so we're able to continue with the presentation during our time here tonight. If you have any questions, feel free to put that in the chat box, or we'll have some time at the end of the presentation to answer any questions that you guys might have about our presentation. So if you guys want to introduce yourself, I'll hand it over to the Janesville team and we can get started on learning about how to support your child's mental health.
Thanks, Erin. I'll introduce myself first. My name is Leah, and I'm an occupational therapy assistant in Janesville.
My name is Shannon. I am an occupational therapist in Janesville.
I am Carissa. I'm also an occupational therapist in Janesville.
I'm Jody. I'm an occupational therapy assistant in Janesville. And Erin's not here to introduce herself yet, but she'll be joining in after she's done with her session.
So we wanted to start off with explaining the difference between some mental health professionals. So we have a psychotherapist or counselor, and that's kind of like an umbrella term for a professional who specializes in emotional problems. They're trained to assist with exploring feelings and behaviors and gaining coping skills. So there's a bunch of different therapists that could be under the umbrella term psychotherapist. So psychologists, psychiatrists, social workers, counselors are all examples. A psychologist is a type of psychotherapist. As we said, the psychotherapist is the umbrella term, who focuses on patients' thoughts and emotional states. They work with like the connection between the brain and behavior. They can diagnose. So there's a certain psychologist and neuropsychologist that diagnose ASD or autism. And they can provide treatment for mental health disorders, which includes counseling or psychotherapy. So counseling and psychotherapy can be used interchangeably. A counselor may or may not be trained to provide psychotherapy. If they're not trained to provide psychotherapy, then they work more with like short-term problems or present problems. I think of like school counselors. And then if a counselor is trained to provide psychotherapy, they work more with like long-term or chronic problems. And then they cannot prescribe medications, but they work closely with psychiatrists, which is our next slide. And psychiatrists, they determine They determine whether an illness is caused by mental health or a physical condition. So they work, they look more closely at like the physical body and how that impacts mental health. So the chemical imbalances, and then they are able to prescribe medications. So they work alongside psychologists to prescribe medications and help out that way. Okay. And then occupational therapists, which is who most of us are. You can get a referral to OT when emerging or mental health behavior or behavioral health challenges impact the child's ability to fully participate in their occupations. We know that children, their occupations are play and school and fun things like that. Don't we wish we all had those occupations? Some of us do. OTs can help address underlying behaviors and or emotional challenges that could impact participation in daily activities. So this graphic here is taken from our OT practice framework, which is just this big long document that our national association put together that talks about what OT is and what we do for a practice. So the main part of OT is we work to achieve health and well-being and participation in life through engagement in occupations. And that last part, engagement in occupations, is the critical point of OT and what we do. And then the blue circle there is what we do or how we do it. So we do evaluations. The intervention is like our treatment plans and what our sessions look like, what we do in our sessions. And then we track outcomes through our goals. And then the purple part is the domain. Those are all the factors that are involved in determining like the treatment that we provide. So the next slide is also from our practice framework, and that takes that outside purple circle and breaks it down into I guess different domains. So it breaks it down. So this is all of like everything that's under OT's scope of practice, everything that we look at when we're determining a treatment plan for a child or an individual. So we work on ADLs and IADLs, so activities of daily living or instrumental activities of daily living, which is like cooking, cleaning, self-cares, and so much more. Health management, rest, sleep, education, work, play, leisure activities, social participation. Environmental factors would be like safety and home modifications. Then there's personal factors. We also look at like the routines and roles and rituals. Motor skills. Processing skills are like the higher level executive functioning skills. So like attention and concentration. Self-regulation is a big one, which also is part of social interactions and self-regulation. And then we look at client factors such as their beliefs, their body functions, their structures, and that kind of stuff.
Okay, so thanks, Carissa. Oh, my chair's really loud, you guys. I'm sorry. I'm classy. So the referral process can be super confusing. So we'll just go through the slides and it'll sound simple probably as we talk about it, but each individual situation can get a little complicated because there's so many individuals involved. Like we talk about the psychiatrist, there's a psychologist, there's therapists, there's primary care providers, and then you come to the clinic and there's rec therapists and speech therapists and occupational therapists. So there's a lot of people. So we can just go to the next slide and talk about the importance of always including your primary care provider. So usually for kids, that's a pediatrician, right? And they're the ones who oversee your child's health in whole. And as we know, mental health is a huge part of health as a whole. So they're the ones who have the long-term treatment relationship with you and your family, and they're going to be the ones who hopefully are able to see the big picture and kind of help put the pieces together. So here's some steps that you can take. These are not necessarily always in this order. So the whole idea of mental health is that it is fluid, right? Things kind of change, and some days are really good and some days are bad. And so this is fluid. So don't feel like if you didn't do it in order, it's not going to work. But what happens is you'll start having concerns, or someone else will have concerns, and you just bring it up. So the biggest thing is to just bring it up and start those discussions, either with a therapist or your pediatrician. Wherever you start that discussion, just, we'll all work together to kind of loop everybody in. If you're looking for someone to talk to on a regular basis, like talk therapy, that would be a psychotherapist. And there's a lot of them who do like family therapy, which is really great, especially for little kids. Some of them do play therapy and combinations of that. If you're, once you talk to your pediatrician and there's some concern that maybe medicine would be helpful, sometimes a pediatrician will prescribe it, and sometimes they refer right to psychiatry. So there's pediatric psychiatrists. They would be the ones who are really good at prescribing medication for kids. And if there's, like anytime there's more than one medication, it's a good time to start talking to your pediatrician about options as far as prescribers. And a pediatrician can refer you to a psychologist who is and a neuropsychologist. So they're the ones who can do some really good testing and, the exams and evaluations to get diagnosis. Insurance is wonderful because it pays for this stuff, but each insurance company is a little bit different. So sometimes insurance companies require referrals that go just like if you go to your pediatrician and they get a referral, sometimes that's good enough for insurance companies. I think there's some that you can just go like right to a psychotherapist, like psychologist or a counselor. I know like some companies have EAP programs where you can just talk to a counselor. But I always recommend checking in with your insurance company. There are some who require you to go through like a 1-800 number triage thing. So like if you have concerns about mental health for your kids, your family, anybody, you have to call this 800 number. It's usually on the back of an insurance card or the website, and they kind of direct you through that process. So it's just really important, because it's complicated, to make sure that you talk to the insurance provider to get the coverage that you need. Things that you want to think about, this is a great slide. When you go to talk to your pediatrician, they're going to want information that is hard to think of in the moment. So if you prepare yourself with this kind of information beforehand, it's really helpful. So what they're going to look for is, and all of us actually, because OT will ask you the same things, like as far as what symptoms are and how we see that, because mental health is hard to see sometimes. So we're looking for changes in appearances, right? So how they look as far as their mood, and then how they act because of their mood. And that'll result in things like changes in eating habits. They might eat more, or they might eat less, or they might eat in the middle of the night. and then maybe they're sleeping more, or sleeping less, or their schedule's all wonky. Sometimes kids will withdraw and just not talk to their friends anymore. Sometimes they're talking to new friends who maybe you feel like aren't healthy. Sometimes they're having these big reactions, right? Like anger is a really big sign in younger kids. And so if they're having those instances of negative behavior, outbursts, or they can look different. You want to kind of keep track. You don't have to like journal every part of it, but keep track of how long those things last, how often they take place, what's happening. It's really important, I think, to like kind of pay attention to like if there's something beforehand that started, and I think there's another slide coming up about more about that. And then like we don't think sometimes about like timelines as far as changes, but it affects kids differently than it affects us. So kind of think about like when school started, or if there's a move, or a pandemic, or just what other big things are going on, and how it's changing with development. So because it really changes a lot. And are there threats towards self-harm or harming others? People are afraid to ask that, especially with teenagers. They're afraid to say, are you feeling suicidal? But it's really important actually to ask that question. Are you safe? Do you have any ideas of hurting yourself? So if they're feeling like you can tell something's really wrong, it's okay to ask that question, because we need to know. And we're not going to put thoughts in their head. Like if those thoughts are there, they're going to be there. And then the question about anxious, are they anxious? That's another thing that can look really different. So we think of anxious often as verbalizing worry, but it can be looking really irritable, being more rigid. So they need to know what's happening. They need to know what's coming next. So that the idea of anxiety is a tricky one, but if they're telling you that they're worried about stuff, that's something to think about too. So that's the kind of stuff that you want to keep track of, so that you can have an idea of what to share with your doctor or therapist. Common signs, here we are. Irritability. Yeah, kids get real crabby. And as parents, it's hard because, we're thinking, oh, they just don't listen to me. Maybe I'm a bad parent, but part of that can really be mental health for a kid. Like they just can't handle life. Those big outbursts, again, the changes with sleep. Physical symptoms happen a lot of times, like with depression. There's a lot of pain. With anxiety, there's pain, headaches, stomach aches, chest pain even. It's really hard to pay attention to if you're having a lot of mental health issues. Like if you're feeling anxious or you're feeling sad, it's hard to pay attention, right? Because your brain is kind of busy dealing with all the stuff that's going on up there. And that difficulty separating. So if you're experiencing these negative emotions, you want to be in places and situations and with people who support you. So it's going to be harder to move away from that. Sometimes bladder problems and bowel problems become evident, and you don't think of it like that. That's the thing about some of these is these things might show up and it doesn't look like their mood's any different. So that's the trick with kids and mental health, is their expressions don't always change, and they often don't know how to talk about their feelings, and it'll come out in these physical expressions.
Yeah, so now we'll jump into specifically occupational therapy's role with mental health. So as we've kind of mentioned, OTs work at promoting mental health in all areas of practice through the use of meaningful and enjoyable occupations. And our role as OTs is to help all individuals develop and maintain positive mental health, prevent mental ill health, and recover from mental health challenges in order to live full and productive lives. So OTs are often not the only professional on an individual's team that would address mental health, as Carissa mentioned, the variety of professions above, as well as other CI team members. So those would make up the team members that OTs may closely work with to encompass an individual's mental health and care needs. So OTs help remove barriers to participation by looking at a variety of factors in a client. So starting with skill development and strength-based skill development, using a strength-based approach, OTs focus on using the child's strengths and abilities and then building upon those skills to increase participation in different occupations. Sensory-based, so creating sensory diets that are individualized and specific to a child's sensory needs. So regulating those overactive or underactive sensory systems for self-regulation. Developing strategies. So this could be relaxation, mindfulness, physical activity, such as movement breaks or yoga for kids, setting routines, such as developing a routine to support adequate sleep, strategies to make tasks easier and less stressful. So this could be such as like altering the environment to improve attention or maybe decrease effect of sensory overload for a child. And biofeedback. This is learning about identifying and changing our internal state of regulation. So it kind of mentions heart rate, pulse, and then sleep and rest, kind of like mentioned above, finding that healthy balance and developing that healthy routine. And then ADLs and IADLs were two of the occupations that Carissa mentioned earlier, promoting self-confidence and independence in these self-care skills. And then social participation, promoting skills such as sensitivity to others, empathy, and pro-social behaviors such as like turn taking and sharing. So using a client-centered and strength-based approach, OTs develop an understanding of the child's primary roles and occupations and promote and focus on activities in which the child takes special interest in. Therefore, like encouraging further participation and skill development through these meaningful activities. So some examples that we listed were cooking or baking, games, arts and crafts, sports, or building or construction. So kind of using those activities and finding ways to work on these skill development. And then just some areas that goal areas may be related to. These are some curriculums or programs that might be incorporated within OT goals for a child. The zones of regulation. This is a curriculum looking at teaching children about their emotional and sensory needs in order to self-regulate and control emotions and impulses, as well as solve conflict. The interoception curriculum. Interoception is the ability to notice and connect bodily sensations with emotions. This curriculum develops and builds interoceptive awareness for the individual, working to develop that self-regulation, those self-regulation skills. The 5-point scale provides a visual representation of social behaviors, emotions, or different ideas, and it assists in teaching social understanding as well as promoting self-management of behavior and emotional regulation. And then finally, growth versus fixed mindset would focus on learning the different concept of each one. So growth mindset being that knowledge and abilities can be developed through hard work and learning, versus a fixed mindset being that abilities are fixed traits and you are born with specific skills and you kind of can't grow those. So kind of emphasizing that our growth mindset through OT.
Okay, so now we're going to focus more specifically on recreational therapy and mental health. And I know, at least from personal experience, people in my family, my neighbors, they all don't really know what recreational therapy is. And that's probably the most common question that I get. So recreation therapy uses play, leisure interests, and other fun activities to focus on a person's physical, mental, and social well-being. So, for example, a really popular thing that I do in my recreational therapy sessions is play different board games. So, you're working on those goal areas of social and turn taking, and what happens if you skip a turn, or how do you react? Do you get mad or sad or have some of those bigger feelings? And recreation therapy provides a positive environment for kids to be able to learn and grow through those activities. And a really big part of recreational therapy is honing in on those interests that the kids have. So something that I like to do is really get to know the kids that I'm working with and using those activities that they find and that they like or want to do in the future, and use that as a way to motivate them to participate in whatever activities that we're doing. With that, we hope to increase that self-confidence within that kid, because you're learning new activities and finding new things that you like to do. So in turn, hopefully that helps increase their self-confidence and helps to foster those feelings of, good things that they like to do and learn when they're in recreation therapy sessions. With finding those new activities, you get to practice those skills and master those skills when you're finding different activities that you want to participate in. And with that, that helps increase their confidence. And when they're doing that, they feel like they're in control of their situation. So a lot of times with mental health, the kids might be having some hard feelings. They feel like they're not in control. They're sad, or they're acting out and not really, being their best self. And hopefully with rec therapy, you learn those activities that you like to do. And when you practice those skills and practice those activities, the kids will be able to really feel like they're in control of their situation, which kind of gives them a better sense of self and awareness of their own environment. And with recreation therapy, you can either do it individually with a recreational therapist or in a group. So it not only increases your self-confidence individually, but when you're playing a team sport or playing a board game, you're having other kids cheer you on, you're talking and problem solving about what to do next. So it's fostering those environments that really set kids up for success when interacting with others. Overall, recreation therapy really tries to increase quality of life, so helping build that confidence, improve those moods, and really just have a better experience when they're participating in activities. Something else that recreation therapy really strives to do is to give kids activities to do and activities that they can pick from when they have a lot of free time. I know if there are some kiddos that have some free time and struggle with being able to know what to do, recreation therapy provides them with resources on activities that they like to do or activities they can do to kind of steer away from doing some of those more negative choices. So for example, if they're having some anxiety around a certain situation, rather than sitting and worrying about it and really being stuck on that situation, recreation therapists would provide those resources by saying, hey, I really know you like music. Maybe let's try learning a new instrument, or creating a playlist on Spotify that we can use when you're feeling sad or anxious, and you can listen to that music when you're having some of those hard feelings. Some other things that recreation therapy aims to do is to decrease anxiety by using some of those social or coping skills. So kind of bouncing off the last bullet point, being able to pick from those activities that we've learned through recreation therapy to use as a coping skill. Recreation therapy also tries to improve mood. So if you think about the things that you like to do in your free time that you like to do, it makes you feel better. So having that, those activities and leisure interests that kids can do in their free time to help improve their mood when they're not feeling their best. And then also recreation therapy is a great resource to have when kids want to try new things. I know sometimes it's hard to branch out or even know what activities that are new that you can try with your kids, but recreation therapists really are a great resource to go to when you're trying to find new activities and different things to try either at home or in your community and environment that you're in too. So specifically at CI, we have CI Connect classes, which offer a different variety of activities like arts and crafts, board games, social groups, and then as well we offer the one-time events, which are either holiday events or fun slime activities. I think that's our next family fun event. So just being able to keep an eye out for some of those activities that CI offers.
So I don't think Erin, our speech therapist, has joined, has she?
Not yet. She has.
Okay. Well, I can just talk. Yeah. Okay, so speech therapy and mental health is huge. This slide you guys can read, but I will say that I've worked in mental health in fields where there was an occupational therapist and a recreation therapist, and it was great. And I had no idea the power of a speech therapist until I came to CI. So that's one of the wonderful things about CI is that there's more types of therapy. So speech therapists work with so many different kinds of populations. And while they're not listed as a mental health provider, they really do help. This part, that second arrow, they help decipher whether a child is presenting with social language challenges and or mental health challenges. That is so huge because it is difficult to tell what's going on. And we all work together as a team to try to figure it out, like we talked about before with different providers, and the pediatrician and the psychiatrist will look at the physical part of it. But there's also this language part that can really become a barrier. So if they are struggling to understand the language or express their language, it can really impede their mood, and it can affect anxiety, which will affect behavior. So this was huge for me to realize the impact that language has on mental health, because it really gives us the power to be able to explain it for ourselves and for the kids to explain it. Without that language, it's really hard to communicate what's going on and how to help. So like if a child is looking like they just don't want to participate, it could be because they can't understand what they're supposed to do. If they're having a really big meltdown, part of that might be because they can't yet express themselves. So involving a speech therapist is really important to kind of help decipher what part of that is really speech and language and what can be helped with other different interventions. So I know if Erin was here, she would explain it better, but I just wanted to say from my perspective as an OT, what a huge value that SLP has.
Okay, so next we want to talk about some ways to support at home, or some things that you guys can do at home if you are noticing any mental health challenges. So the first one, acknowledge and praise appropriate behavior. And oh, Erin's here. And we really would like to see you guys be specific about it. So acknowledging that you're happy to see that the kid is doing something that's really exciting to them. You must be proud, like really acknowledging that can help the child, I guess, see and understand that themselves, because they might not get that. Using you can language. Um, so saying, I can see this makes you feel frustrated, you can ask for help. So saying that I can see that this makes you frustrated and acknowledging that that's okay. It's okay to be frustrated. I get frustrated too. This is what we can do to help you. We can ask somebody else for help. Establishing routines and consistency is something that we've talked about before, and any CI therapist can help make visual aids. Um, it can help a kid stay on track, follow a plan. ChoiceWorks is a great app if you haven't explored that. That's a great app um, for kids that I've used in session and I've seen be very successful in session. First then boards. Um, Erin, I know you've probably used this more than I have. I've used the language, the first then language. First, we're going to do this, then we're going to do whatever else comes next. But speech therapists are awesome at putting that into a visual for kids to use. It can really help um, set like a routine and help the kids see what's coming next so that they're not overwhelmed or put off by something spontaneously happening. And then communication with your therapist on carryover of strategies and techniques. So don't be afraid to ask your CI therapist about anything else that you can do at home. Erin, did you want to jump in or add anything? I know you just came on. It's okay if you don't.
Sorry guys, I'm a little late. I love how Carissa kind of described the routines and kind of creating the first then board. Just kind of what she was talking about from like a speech lens. In some situations, like if a child is still developing their language and their like receptive language, they may not always completely understand like what we're saying to them out loud. So putting a picture or some sort of visual with it is sometimes helpful. It also is kind of handy if you have like a bunch of picture cards available that you can like give them the card and tell them if they want to do it first, they can put it here. If they want to do it next, or then they can put it in a different spot. So it kind of can give them some control over it while still allowing the adult to be the one who's picking what activities are available. And then it also kind of is nice if you have the visuals and the kiddo responds well to those, you can take the visual right off when you're done. So it kind of gives them that time limit, like, hey, I have to do this activity. Once it's done, I can get rid of it. And you can like physically move the activity and get rid of the picture. And kind of like what Krista was saying, to prevent them from being overwhelmed, it only presents 2 items at a time. So rather than having a complete visual schedule of 6 different activities, which ChoiceWorks might present, the first then just gives them a small amount of information that they would have to handle. And kind of like Krista was mentioning, I don't know how familiar everyone is with ChoiceWorks. It's basically just a visual schedule that once the child is done with the activity, they can drag the picture over to the all done pile. So it kind of gives that visual reinforcement and feedback that, hey, I'm done with that activity and I don't have to think about it anymore, which might kind of help with that stress management if there are particular activities that maybe aren't a favorite or they're really thinking about being done with. It kind of gives them the opportunity to like have control of moving that piece, which a lot of kids I've used it with really enjoy that. Depending on how kiddos respond to like auditory feedback, the app does have a feature where like if you push the button, it'll read you what the button says. And then when you slide it over, it'll tell you all done. So you get kind of that auditory piece. So that's something just to kind of consider what the individual child responds best to, whether it's just visuals, visual and auditory. one, the other, all of the above, just to kind of be able to fit it right to them.
Another great thing about that app ChoiceWorks is they have set pictures that you can use, but you can also, it has a camera mode where you can take pictures of the kids, the kids' routines or like things in your house that you use, so that they have that like exact visual of the item that they use. And you can, it also has like a voice record button, so you can, like Erin was saying, if you push the button, it'll like read the picture that's there. But then you can also record like your own voice saying like, next we will go to the bathroom, and you can take a picture of your bathroom. And so they have that visual of their bathroom and they hear your voice. And there's also, I believe, timers. You can set timers somehow too for each activity. So it's a really cool app. And then the next slide, I believe, yes. So another thing that that you can do at home, which is super fun, is you can create a calm atmosphere. So that could include like a physical atmosphere, like a fort, where you can use like their room or their closet, or you can build a fort, which is super fun. But also when you're calm, it's more likely that the child will be calm too. So creating like an atmosphere that way, not so much like a physical atmosphere, but like a mental atmosphere where like you're modeling staying calm, you're modeling breathing. I know it's really hard when somebody around you is getting ramped up, but if you can keep your calm, then it's more likely that they would be able to keep their calm or calm down faster. So there's some pictures, there's some super fun pictures of forts or just calm, or some people use the word safe space too. And then one thing to think about is if the child or individual is sharing a room with a sibling, to make sure that they have either a space within that room or somewhere else in the house that's theirs, that they can go to for privacy, and where they can be safe and just have a quiet atmosphere. There's nothing really, I guess, that you can't put in their calm space. It's going to depend on the kid. Anything that helps relax them. So books, music, any specific sensory items that they have, or preferred items. Blankets and pillows are always nice and cozy. Stuffed animals or puzzles. And then if you're having trouble thinking of like what types of sensory toys or sensory items to put in, you can always talk with your CI therapist too, and they can help provide suggestions that are more like specific to that child or individual.
Sorry about that. The next slide that we have kind of talks about acknowledging and recognizing when we have anxiety or fears. And as an adult, I think one super helpful thing that we can do for children is just to acknowledge that we have these feelings too. I know a lot of times for kids, it can be super overwhelming and scary to have these feelings and not always have that control over what's happening in our body or how we're feeling. But just for a kid, letting kids know that like we feel these feelings, sometimes we have a hard time dealing with them. Letting them know that that's something that we're all working on too, I think can be super reassuring, especially I feel like for our young adults who are going through a lot of different changes in their lives, just to know that we've gone through it too, and we're here to support them. Jody will have some awesome ideas with this too. But some of the ideas that I've kind of used with clients or with children is like having a journal. Now this can be in many different forms. It can be like a written journal for kiddos who maybe are having a little bit of a harder time with kind of that writing piece. You can use apps that do like speech to text, so it'll kind of write it for them. That might be particularly helpful if a kiddo is maybe feeling a little bit more escalated and just wants to get the ideas out. So that it's kind of therapeutic. I mean, I know we've all vented to a friend or kind of just, I don't know, even venting to ourselves just to get the feelings out. Using that type of app might be helpful just to do that. And then later on, if or when the kiddo is feeling a little bit more calm or regulated or has found kind of that safe place, they're able to reflect on it. So they aren't forced to do all of that hard thinking in the moment, because really when we're stressed out, we aren't able to do that. So having a journal or some sort of resource to help you reflect later is very helpful for children and adults. For kiddos who maybe aren't at the level to be able to do writing or completely verbalize their ideas, or if they are nonverbal or still developing their expressive language, drawing pictures or just using art is an incredible way to be able to get what you're feeling across. I don't know, Jody, you have awesome ideas with all of these things that you can definitely add in here too.
Yeah, Aaron, that was great. I think the journal idea, keeping an open mind, like you said, about what a journal is, the writing, the drawing, the video would be another one. Like, not, you could record it, but also, you know, technology today is like video, right? Video for little kids is actually surprisingly powerful, because it gives them the opportunity to go back later and be like, oh, that's how I was acting. Like, I didn't realize it in the moment. So that can be actually power. I mean, it needs to be used in a positive way, right? Not like, ooh, look at how hard that was. Big Life Journal. There's a picture of the kids one. I have a copy of one for teens. These are really great. There's like a whole program. They have podcasts. They have a website. But these are cool because the journal it's based on the growth mindset. And there's stories in here, and then there's places where you can write, and there's some drawing things. So it's really kind of got a lot of different parts to it. You don't have to like go in order, you can skip around. So this is something that's helpful. Again, when you're really upset though, this is hard to use because it does require a lot of cognitive stuff. So with all of these things, I would say, like, in the moment, you're gonna want something like hands-on, like an activity, rec therapy, right? In the safe spot, in the sensory stuff. So in the moment, you want to just kind of get through it. And then after the calm is there is when you can kind of use some of these other tools with the executive functioning. Sometimes just books are helpful. And there's a lot of books like The Angry Ninja that just kind of bring up the language of how to discuss mental health. I've got, this is one of my favorites, Angry Octopus. Julia Cook has a whole bunch of books. This is My Mouth is a Volcano. A lot of them about, you know, just they're great ways to introduce the language of feelings and mental health. Like, even how are you peeling? It's foods. So it kind of brings it up in like low pressure ways to start that conversation with kids and build that opportunity. But there's tons of books out there that can be overwhelming too sometimes. I know, like, for instance, this is What to Do When You're Scared and Worried, a guide for kids. And it says it's for kids. There's no way a kid can pick this up and use it. So it works really great, but it definitely requires like adult work with the kids. So that's the other thing to remember in all of this is, as family, as adults, as therapists, our job is to help our kids get, you know, a handle on it. It's not, they don't need to be fixed, they're not broken, but it's just something to deal with, and our job is to help them do that.
I'm going to spend some time to talk about the value of visual supports. This is a helpful tool to use for any kind of communication. It can be used for identifying emotions, even with calming strategies that you may need. I make them a lot for my kids, very personalized, especially for OT. I mean, I can personally relate. I'm sure many of you can too. When you have very escalated feelings, it's hard to get your words out and verbally express. So I did post a picture of like a basic emotions chart. where I've had kids just they can use a dry erase marker if it's laminated and just circle it, so that they can at least acknowledge, okay, this is how I'm feeling. Now I'm aware that they're feeling scared in the moment. In the middle is a picture of a body check chart. This kind of correlates with the interoception curriculum. So I've used this type of visual. I typically make them very personalized. So it might be a picture of the client with arrows pointing to different body parts. And we can kind of go through and, okay, how are your hands feeling right now? They might feel a little shaky. How is your skin feeling? It might be warm, it might be cold. How is your brain? Is it focused or distracted? And then it's really taking all of those sensations and feelings and attributing them to an emotion. Obviously, it's going to be different for everybody. So how my body feels when I'm angry is probably different than everybody on this call right now. But this is just a nice visual to help people recognize and really think about each of their body parts and then correlate it with an emotion as well. We also have the zones of regulation. I've made a lot of visuals with this. I've made each zone be a different animal. So the green zone is kind of the optimal arousal level. So that's typically like their favorite animal. The red zone is when you're feeling angry and really upset or terrified. So that could be an animal where the kid really hates and doesn't like. So for me, it might be a shark. I don't like sharks. But then just making it very personalized, I think, is also important because it makes it more motivating for somebody to use when it's something familiar and very personal. On the next slide as well is a few more visuals that I've personally used as well. The 5-point scale I have found to be especially helpful for parents and caregivers. This could also include like respite workers. It could include any member of the child's team. What I have typically done with clients is we have our numbers. So 5 tends to be the most heightened. So for this particular example, we made an anxiety scale. So a 5 is, they labeled it as feeling super anxious. We were able to kind of identify what it looks like. And this part is especially helpful for those caregivers and parents so that you can also recognize, oh, my child is feeling really distracted right now. They can't focus. They've stopped communicating. They're feeling really anxious right now. These are some things I might be able to do to help them also. Especially with the heightened emotions, people might not be able to identify it and do these strategies on their own. So having that parent or caregiver step in, recognize where they're at, and find some strategies that can help. I've made these in collaboration with the client and with the parents, so then we can all talk about it. We have a solid idea of what it looks like for each level, and then helpful strategies to support each one as well. The next one is just kind of a when I am feeling, and then this one is for when I'm feeling anxious, and then it just provides different strategies to help. Typically, these are ones that I've trialed with clients. They are successful with heightened emotions. So then they can just be on there as a visual of, oh, I'm feeling this way. This is what I can do to help me feel better. And sometimes it's more than one of these. So you might need a fidget and you might need music on. And that just multi-sensory aspect will really help also. But it's very important to make it very individualized. So I wouldn't use this same when I'm anxious for all of my clients. Obviously, these things might not be available to everybody, but they're also not effective for everyone. So the important thing is to really make it individualized for each one.
Another thing to think about when working with children or young adults is just to make sure we're offering a variety of choices. Sometimes when we are feeling stressed or when we're having kind of bigger emotions, it's hard for us to think about what we can do or what's available. So having those different things presented to us can be helpful. As a speech therapist, this is something that I continue to work on. When we give a choice, it's awesome that we give them that information, but it's also so important that we pause and give them an opportunity to think about what the choices are and to respond. I know the pause is hard. The pause is really hard. But it's so important just because it gives them that opportunity. If they are having difficulty with any receptive language or language related pieces, it gives them that extra time for processing. It also gives them time to access those cognitive resources to even know what you're telling them. So that's something that I always have to tell myself. Sometimes it's a matter of just counting in your head, give them 10 seconds. If they don't respond in 10 seconds, maybe they need a little bit more support, but just making sure that we're giving them that little bit of time. Also, if you are noticing that your child or someone that you're helping is feeling overwhelmed or they're showing signs of being escalated, try to limit the number of choices you give. You can always add choices if they aren't going for the ones that you give them, but usually I aim for like 2 choices to start out just so that they don't have too much to think about. And I also keep in mind that not making a choice can be a choice. So you can always say, you know, you can choose or I can choose for you. Or sometimes when we're working with like families with a parent present, we could say, well, you can choose or mom can choose, or you can choose or sister can choose, or whoever is there, just to kind of say that it isn't all on you and that a choice will be made, whether it's kind of you helping with it or if we're going to kind of help you with that. And if the child isn't ready to make a choice or they don't know how, it's definitely okay to like model how you make a choice. So you could say like, I think I want X, Y, or Z, and then kind of model how you would go about following through with that choice. Because sometimes that follow through can be a little bit tricky. Similar to how we talked about like having visual schedules and other visuals present, sometimes kiddos respond well to having choice boards that are pictures or images so that they can either circle or move the picture or like have that tactile feedback. I want to say that there are ways that you can do these with like audio too, so you can have them be able to have that audio feedback for whatever they pick. Sign language is awesome if kiddos prefer things to be more quiet and not to have those pictures for visuals. It also gives them another way to build their expressive vocabulary in just a little bit of a different way. So all sorts of different modalities that you can use, but just kind of helping kids know what their options are so that's not all up to them to figure out.
The next one is problem solving. So I think Jody kind of briefly touched base on this when she was talking about the referral process, but when we see those challenging behaviors, thinking about what the individual or the child is trying to communicate. So an ABC chart is a helpful tool to track how an individual may be communicating their specific needs. They monitor, so it starts with the antecedent, which is what comes before the behavior. The behavior itself is the response from the individual or the child, and then the consequences, what comes right after. Just a quick example could be like the antecedent being an adult presents vegetables to an individual at mealtime, the behavior being the individual or the child cries and pushes the food away, and the consequence being the adult takes away that non-preferred food. So that possible function that you see is the child is trying to get away or escaping from something in this case being that non-preferred food that they don't want. An individual may demonstrate a similar looking behavior multiple times in multiple different situations. However, with different antecedents or the thing that comes right before the behavior each time. So this may demonstrate that the individual trying to communicate different things, even though the behavior may look similar. So without tracking and kind of staying curious and watching those regarding what action may precede the behavior, we may think that the behavior means the same thing each time. So kind of showing how helpful these ABC charts and tracking behaviors may be helpful when determining what your child is trying to communicate.
Collaboration is also very helpful when supporting your child with any mental health. Typically, if you're at CI, we will typically ask you if you're comfortable with us communicating with any other outside providers. And then we'll ask you to fill out ROI, also known as a release of information. This just helps provide a very well-rounded course of treatment where we kind of take all aspects and we can collaborate and all be on the same page to best treat your child. And then we will typically reach out to either it can be schools, like a school psychologist as well. It can include teachers, a psychologist, psychiatrist, any of the other professions that we've listed. We can also, we highly recommend collaboration among like ABA providers if you're getting like that kind of therapy as well. So then once we have the ROI, we can ensure that we are able to reach out to them. So we'll kind of ask them what they're working on. We'll share what we are. We tend to give recommendations back and forth of this language has been very helpful. We're using zones of regulation. So if you can help support that by using similar language as well. It's also helpful in sharing our own observations, especially if there are medications involved. We might be able to notice, oh, we saw this could be a side effect. So definitely updating your therapist as well if there are any medication changes is helpful. And then we can share that also. We also make sure that any information that we share with these providers is nothing new to the parents or caregivers. I have oftentimes included the parents and caregivers in email communication, but all information that we typically share between has already been shared with the parents and caregivers. So it's nothing new, it's not hiding anything. And you can definitely ask if you do want to be included on those emails to just have you CC'd on them, and we're more than happy to do that. On the next slide, we just kind of wanted to go over a few examples of how we have collaborated with other professionals. So in this example, I was working with a pretty complex young adult who had a lot of high mental health needs, along with other diagnoses. Communication was primarily with emails just due to the number of providers involved. It was then decided as a team to try to all meet together. Just due to a lot of changes going on for this client, email was not as time efficient. So I was actually able to collaborate with probably about 5 or 6 other providers, and we were able to set up a meeting that included their guardian so that we could all be on the same page to help support this client. We were able to come up with great strategies for all of us to use. We were able to delegate, okay, can this person make this kind of visual? Can you collaborate with the psychiatrist? The psychiatrist was not able to be there, but they were given the notes afterwards. And it was just a nice time to really sit down and just focus on that one client and figure out what does this client need in all of the environments that they consist in, and how can all of us work together to make sure that he is safe and doing what he needs to do. So we were able to create a plan to best support him while we were all able to work together to create this specific plan for him. And then he was able to be supported at home, at CI, through his work environment, and then also at his guardian's home as well. Another example of how we have collaborated with other professionals is the mother kind of identified that the client had been seeing a psychologist to support with his anger. He had a lot of sleep concerns. He wasn't sleeping through the night without a parent being there, as well as some separation anxiety. The OT was able to collaborate with the psychologist as they were targeting similar areas, as sleep kind of falls within both of our domains. Again, we had the ROI filled out, so it was okay for us to collaborate. The OT was able to reach out to the psychologist and set up a phone meeting instead of email. Through further discussion, we were able to collaborate on how to best address the sleep habits so that we weren't both targeting the same thing but taking different approaches. We were able to decide that the psychologist would primarily work on the parent education and then supporting him to be able to be in his own bed without having to climb in bed with his parents, while the OT worked on primarily the self-regulation and the calming strategies to help prepare him to calm down in order to get more beneficial sleep, and then stay asleep longer as well. So we were able to get a nice routine for him, and we were able to have great communication among us as well. This is just some examples of different games or books that some of us have used within sessions. We tend to use a lot of books to help educate on different emotions. So these are just a few examples, like When Really Worried, When My Worries Get Too Big. We've talked about the Big Life Journal. This Funny Faces game is a nice one to work with emotion identification. You could even, when you're feeling a different emotion, make that face on here instead of having to verbally tell it, kind of like that visual support. Mad Dragon is another fun one to work on some anger control. There's also a mindfulness game to help with some kind of calming strategies and mindfulness activities. And then there's an emoji dice, which kids tend to enjoy, working on identifying the feelings that are on it, but then also engaging in that conversation of what makes you feel nervous, or when have you felt proud of yourself or brave. So kind of talking about the not so fun emotions, but then also emphasizing the positive ones and thinking about when we have felt really good about ourselves and how overall you felt about that.
Okay, so we're in Rock County, Janesville Clinic. So we have Rock County resources. I don't know where our viewers are from, but each county will have different resources. Here in Rock County, Hope Child and Family Counseling, Compass Behavioral Health, Mercy Options. Mercy also does date treatment. So the day treatment's on there, but they do individual therapies as well. Compass has Saturday and bilingual. One of the things, there's another page too with more. As you think about what provider to use, is to really consider, location and hours. Right now, you want to think about if you want to do in-person or virtual. Like I know right now, Genesis is offering in-person. Some places aren't there yet, and it's, whatever you're comfortable with. Crossroads has day treatment also. I think both Mercy and Crossroads do kids and adolescents, one in the morning, one in the afternoon. But through the county, there's usually, each county has resources for mental health and for kids and families. NAMI is another great resource. You can go online. It's NAMI. And then, always check in with your CI therapist, and we can get you individualized resources for people right around you.
Thanks so much for joining us on CI Connect for our parent training series. If you have any questions, please contact us at connect@citherapies.com. We hope you join us again in the future.